Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Hope you guys are having a great Monday evening. Apologize for being a little bit late. Had some technical difficulties with some apps, and so I had to fix and correct those. But I am here, and I appreciate you being here as well. To all the men, to all the fathers, happy belated Father's Day. I hope you got everything that you wanted. Lots of socks, lots of ties. In reality, I hope you had a wonderful day spending time with your family, as did I. So thank you again to all the fathers out there who are going above and beyond in order to make your kids' lives great. So hey, make sure too, guys, tag a father who would benefit this. I'm going to show you in just a second why, because there's a really important announcement that I need your feedback on, especially. So make sure that you watch this video all the way to the end, because in just a second too, I'm going to ask you guys a question I need your feedback on. So let's talk about something very common. I see a lot of patients, new patients that come in with on what they're doing, and that has to do with supplementing with zinc, that you need to watch out specifically for this. And the reason why is over the last 2 years, and you know why, is people have been following immune system quote-unquote boosting protocols that call for zinc, among other things. And so I've actually seen a lot of people that have been taking high-dose zinc isolates for an extended period of time. And I'm going to show you what you need to watch out for and what to do instead. If you guys are watching right now, please make sure that you say hello and let me know where you're watching from. I always love seeing people from all over the world that watch every time that I go live on Mondays. So thanks again for watching. Make sure that you say hello. Make sure that you guys let me know where you're watching from. I know that we have people from the United States, from Canada. Hi, Canada. Hope you guys are doing well. New Zealand, Australia, from Europe. All across the globe, and I always appreciate when you say hello just to let me know where you guys are watching from. All right, so before we go into zinc, what you guys need to watch out for, I want your feedback. So please give me your feedback, because coming up 4 weeks from Saturday, we're going to be kicking off here in Yorkville, Illinois. We're going to be kicking off our in-person event. It's called Man Up. We're going to be taking men through a 4-week mentorship on how to increase your testosterone without all of the gimmicks that are out there. You don't have to look very far to see advertisements for male clinics that are giving exogenous testosterone, or all of these quote-unquote testosterone boosters that call for no change in lifestyle whatsoever, guys. And I'm going to tell you, the most powerful thing that a man can do in order to boost their testosterone is changing their lifestyle. It has a lot to do with sugar. It has a lot to do with fasting. It has a lot to do with alcohol. It has a lot to do with sleep. And it has a lot to do with the way in which a man is working out. And that's why we're going to go over all of those different things through the 4-week mentorship that we do here in Yorkville, Illinois. But here is where, if you are watching from a different location, here's where I need your feedback, because we've had a lot of people who request, hey, obviously my man, lives in Arizona or lives in Canada or lives, halfway across the world. How can they get involved? So my question to you guys is would there be an interest in being able to provide the Man Up Challenge online, in which basically you see the talk that I do in person, and then join us within an individual Facebook group and kind of take the journey with us through the 4 weeks. Obviously, you'll be following what we're doing with nutrition. Obviously, you'd be doing what we're doing when it comes to fasting. Obviously, we'd be doing the same thing when it comes to recommending, yes, some specific things if you're cleaning up your lifestyle as far as supplementation and testosterone stimulation, but also, following along with how we're working out as well. So if there is a desire to do this online, yes, there will be a charge for it. It won't be free because of the time and the resources and the staff that is needed in order to be able to handle this. But if there's an interest, just make sure in the comments that you put yes. But please make sure you ask your man first, all right? A lot of women are going to say yes, please. But again, this is going to have to come from the man. It's going to have to be the man's idea. because if you know men's hormones, if a man doesn't want to do something, it doesn't matter the amount of goading that you try to do, they're just not going to do it. So it's going to have to come from them. And we would be willing to do that. We first must fill the in-person event because we're going to need at least 30 people to do it in person. And then once we have that, we'll open that up to doing it online. And once we know that there is that interest, then we'll make it really easy to be able to enter into the online Man Up Challenge and go with us through the 4 weeks through our mentorship, through our individual Man Up Facebook group. So if there is, again, a desire for your man, for your husband, significant other to do this, just please comment yes, and we'll look into being able to provide that for you as well. So again, make sure that you comment so that we see if there is a need. We'll try to fulfill that. As best as we can, but there's going to have to be that interest for it. Okay. So I'm going to give you guys a different perspective today when it comes to zinc. And just like I said before, there's a lot of people who come in and they're doing a specific protocol. Now, I can name this protocol off my head because I've seen it so many times. So people are coming in, they're taking 1,000 milligrams of vitamin C, 5,000 IUs of vitamin D, they're taking 50 milligrams of zinc, and then they might also be taking quercetin as well. And sometimes people might be taking hydroxychloroquine or ivermectin as well, and just indefinitely. And guys, I'm going to show you the protocol where a lot of people are following this from actually wasn't meant to follow indefinitely. It was actually a 7-day protocol for low to moderate risk people, okay? So let me give you a different perspective on zinc supplementation, because we're going to kind of open the whole door as far as there's so many things when it comes to quote unquote natural health that you need to be paying attention to, because quite honestly, there's a lot of bad advice out there in which it's not medicine, it's natural medicine, which is the whole idea of taking this for that. That if I just take this, then all my problems are going to go away. If Dr. Oz says you need to be taking zinc, then the health food stores the next day are completely empty because Dr. Oz said so, and now I'm going to add zinc to my regimen. And in fact, we had a patient who came in that was taking 36 different supplements. I counted them and was still sick. And in fact, my office is full of people that are taking so many different supplements and yet they're still sick. And I'll show you why when you start to connect the dots. So let's talk about a different perspective. And so a lot of times I have people, even in the natural world, who will argue with me, but they're going to argue from their perspective. But I'm coming from a completely different perspective, just like when you look at this picture here. Here you have two people that are looking at that thing right there, and according to their perspective, one person says that's a 6, and the other person from a different perspective says that it's a 9. Now, who's right? They both are, because it's a matter of a perspective, the perspective that you are actually seeing it. I even have medical doctors who try to argue with me, but they're trying to argue with me from a medical perspective, and I'm saying I'm coming from a completely different perspective. And so, yes, you are right according to a medical perspective, but I don't want to see it as a medical perspective. And the reason why is there's a whole heck of a lot of sick people that are out there because they're coming from a medical perspective, or they're even coming from a natural health perspective, which many times is, well, let's go ahead and maybe do an organic acid test, or let's go ahead and test this, and oh, look it, you're deficient in this. I think you might need a little bit more B12, you might need a little bit more zinc, you might need, something in order to help some inflammation. But we're going in the wellness way, we're going so much deeper and looking at the whole entire system as a Swiss watch and how everything affects everything. And I will tell you this, there are no better doctors in all of healthcare that understand physiology better than a wellness way doctor, and how we're able to connect the dots together. So we're going to show you a different perspective, because again, the perspective that you're coming from will determine whether you see it as a 6, whether you or see it as a 9. And I guarantee there are going to be people who are going to argue with me in regards to zinc, but I'm going to show you a different perspective when it comes to quote unquote boosting the immune system and doing these immune system protocols indefinitely with no testing associated with doing these protocols. Just remember, I think the thing that probably makes me the most, I don't know, agitated, if you could believe I do get agitated sometimes, is when people ask me the protocol. What's your program? What is the protocol? And there is none, because everything is individualized based on that person. That's how healthcare actually should be. So let's talk about a popular protocol that a lot of people have been following that are in the natural health world, and it's the COVID-19 pre-hospital protocol. Now, this was actually came up with by a physician, Dr. Zelenko actually, and so he came up with this almost as like an emergency type of thing, saying, hey, listen, this is what I found that actually works. Here's what you need to do. And you have your low risk, you have your moderate high risk, and here's what you need to do to follow the protocol. And this is actually if you have COVID-19. So let's just look at the low risk. Number one, rest, oral hydration, and fever control. Now, I'm going to say this. Fever control, do you really want to control a fever? But that is a medical perspective in which people say a fever is bad. But guys, when you are exposed, for example, to a bacteria, that certain bacterial fragments that are eaten by the immune system will release specific immune chemical compounds known as interleukins that then travel to the brain that will cause the brain to elevate your set temperature. And the reason why that is happening is because it will increase metabolism and it will increase enzyme rate to get the immune system stimulated to work harder and work faster. It's actually a really good thing. We are actually conditioned to believe that a fever is bad, that a fever is supposed to be controlled, and it shouldn't be, because the body never, ever messes up. So the first problem I have is let's try to control the fever, and I'm like, the fever is actually the cure. But then we have taken elemental zinc, 50 milligrams once a day, 1,000 milligrams of vitamin C once a day, 5,000 IUs once a day, and then taking quercetin, 500 milligrams twice a day, or EGCG, 400 milligrams twice a day. Now, what's interesting is that when we have tested people, I've actually recommended some people to be on 50,000 IUs for a whole entire month when we are testing it. And even coming down to vitamin D, guys, you're going to have poor vitamin D absorption if you don't even have a gallbladder. And so this is a protocol that can't be written based on a person's individual needs, because we don't know if this person has a gallbladder. We don't know if they have a problem with stomach acid production. We don't know any of those things. And in fact, on the whole idea behind quercetin is quercetin actually slows down the COMT enzyme that's involved with methylation. So if people can't, you shouldn't have that enzyme slowed down, you can run into long-term and inhibition of the COMT methylation pathway that will actually influence the liver's ability to be able to detox. Now, there are actually some cases where quercetin can actually inhibit this, and it should be inhibited. And this is actually in a lot of people who have problems with what's known as over-methylation. And over-methylation, people who over-methylate typically have anxiety, typically have depression, schizophrenia. A lot of times are going to have some level of mental illness. So yes, there is a chemical component to mental illness either, and it has a lot to do with methylation and this specific enzyme. So when you look at this, what's interesting at this treatment protocol is that it actually only called for it for 1 week. It didn't call for it for 6 months, didn't call for it for 1 year or 2 years, but I've had people coming in and they're taking 100 milligrams of zinc, of a zinc isolate, and I'm saying, well, who told you to be on that? And they said, well, I followed this protocol online. I thought if doing it for 7 days is good, why not do it for a whole entire year? And this goes to show you that, guys, that so many people think that if this X is going to boost my immune system, then maybe actually taking 4 times amount will make my immune system even more boosted. And instead of getting me to sufficiency, maybe my immune system will work at 400%. And guys, when it comes to the immune system, you can't boost the immune system. The only thing that you can do is provide sufficiency. And yes, sufficiency in your immune system is more than enough. Remember, 2 people exposed to the same virus, 1 person sick for 3 days and 1 person dies. It's the same virus. So what's the difference? Is the adaptability of the host. Here's what's so interesting. We're not talking about that in healthcare. We're not talking about that in the news. We're not talking about any of that. In fact, I just saw an article that said this: COVID-19 is coming back. The Delta subvariants are coming back. Vaccination will not be enough. What are we supposed to do? Well, I think it's pretty clear that vaccination has been a complete and utter failure since I've been saying this since day one. But one of the things is now they're actually saying, well, we need to do more, which means probably more masks, probably try to social isolate. And if you're watching this, I'm going to tell you something. If you've been watching me, you know better. You know better. So there's other treatment options on the moderate to high risk, which I take offense to this because they say if you're at moderate to high risk, if you're older than 45 years of age, which I will be in about 8 months, and I do not consider myself high risk. But then they start talking about going on antibiotics and then going on hydroxychloroquine or ivermectin, and a lot of being on prednisone, blood thinners, monoclonal antibodies, things like that. Which people will ask me, what's your opinion on this approach? And here's what I say. I say, I don't have an opinion because this is a fire department approach. When people say, what's your opinion on this drug treatment for this? I can say, well, I can tell you why this doesn't make sense. But again, I'm not a fireman. So this is the fire department approach in order to try to quickly get someone up to sufficiency so that a common viral infection won't cause things to make you go into hospitals, because it was actually the hospitals that were causing really the big issues that were going on. You don't have to look very far to see what was happening in hospitals that was absolutely crushing people. And you can say all the different reasons why. I have an opinion on some of the reasons why, but the idea is that the hospital success rate was absolutely abysmal. And so yes, this was a protocol that was used to try to keep people out of the hospital, but again, it's a fire department approach. I'm not a fireman, I'm a carpenter, and there's a difference between the two. This is why I always say, hey, medical doctor, you are a fireman. You do a great job as far as helping people get out of an emergency situation, but you know what I do? I'm a carpenter. I'm trying to prevent people from needing the fire department, but not only that, after they've gone through their fire department care, what can we do to rebuild and repair the body so that they don't need you again? And this is why when you look at doctors providing nutritional advice, exercise advice, they just say eat better and exercise. But people say, well, tell me exactly what? Tell me exactly why. And even over the last 2 weeks, I have seen some of the most horrendous advice as far as nutrition. In fact, one person came in, they wanted to lose weight. They said, what did you try? They said, well, I went to my doctor and they told me to do GOLO, which is a protocol that's popular, obviously today. I'm like, did he really look into it? Or is this just something because it was top of the mind awareness because it is heavily marketed today? So this is the fire department approach, but let's start looking deeper when it comes to the immune system and when it comes specifically to zinc. Now, am I telling you that zinc necessarily is bad? Not at all, because our bodies need zinc. We need a lot of different minerals that are used as cofactors or used as in enzyme reactions inside of the body to build things. So your body absolutely needs zinc, and in fact, zinc is pretty incredible because you look at what zinc contributes to. Number one, zinc can inhibit viral replication. So is it possible to be deficient in zinc and have a viral issue that's going out of control? Absolutely. I just had a patient today. We looked at her immune markers. They were terribly low. At her expanded panel, extremely low. And she was on a viral inhibitor for the last 3 to 4 years because every time she went off of the viral inhibitor, she would break out with cold sores all over her face. Well, it was no wonder, because we looked at her immune system and we saw how terribly deficient she was in specifically things like CD8 cells, in which she would never be able to handle any kind of chronic viral infection unless you get those cells up. So what she was doing, instead of getting the cells up, and no one ever tested for it, she was taking viral inhibitors in order to prevent replication of that specific virus within the cell. So she was just trying to keep the viral load under wraps, versus increasing the immune response and providing sufficiency to it so that her body could actually get rid of the virus completely. So it inhibits viral replication. Now, there's things that you can take naturally that can inhibit viral replication. Zinc is one of them, but so is licorice. They're talking about today providing medications that are viral inhibitors for COVID-19. They haven't worked. They've worked terrible, which is why they haven't rolled them out yet. But they don't tell you that certain compounds that are known in herbs can be used as viral inhibitor. And like I said, one of them is actually licorice, and the other one is actually zinc. But there's no money in that. Okay. So what it also will do is antiviral. It actually helps to build the barriers within your body. So zinc is going to be very important for skin health, okay? It's a barrier. Zinc is going to be very important for your lung health and lung barriers. Zinc's going to be very important for your gastrointestinal system barrier. And you know, this is why when a lot of people are having GI barrier type issues, multiple type food allergies, sometimes they actually do in fact need extra zinc. But people think, well, maybe if I got GI issues, I'm going to take zinc. But people don't understand the reason why. So what it also will do is that it will help to sustain cytotoxic T cell, which is your CD8 cells. It will help with your natural killer cells. Both are responsible for a viral infection. It will actually help regulate what are known as macrophages, which are known as your antigen presenting cell. And it will help with B lymphocyte antibody production, and it also will help with your neutrophils, and it will actually help with reactive oxygen species production. So it's actually working on almost every single immune cell, and it's working with your barriers, and it's also used as a viral inhibitor. So it's inhibiting the replication of viruses. So it sounds pretty good, right, that it's doing that. But guys, I'm going to tell you something. If you read Guyton's medical textbook of physiology, they say you need about 10 to 15 milligrams per day in order to be able to provide sufficiency. But a lot of people are taking these zinc isolates, and they're taking 50, 75, 100, so they could potentially be taking 6 to 7 times the amount that they need, because again, a lot of times people will say, well, if a little is good, maybe a lot's going to be a whole heck of a lot better. If you don't believe me, go ahead and instead of taking 1,000 milligrams of vitamin C, take 5 to 6, actually I wouldn't do this, but if you took 5 to 6 grams or 5 to 6,000 milligrams of vitamin C all at once, you're going to be running to the bathroom pretty quickly, okay? So your body needs about 10 to 15 milligrams per day. Now, are there a lot of people who are zinc deficient? Yes, absolutely. I actually think, looking at the number of people who had a really bad day when it comes to COVID, that yes, a lot of people were zinc deficient. So the question is why were people zinc deficient? Were they not getting enough in their diet? The answer is maybe, depending on what their diet is. So how can you become zinc deficient? Okay, it's not just I'm not getting enough zinc. It can also be problems with absorption. It can be a lot of different things. However, from a nutritional standpoint, and I'm going to show you why in just a second before people lose their mind, because if someone is vegan, it's very easy for them to be zinc deficient. I'm going to show you why in a second, but I'll give you a preview. The reason why is that sources of zinc coming from plant sources are a lot harder to absorb than ones that are coming from organ meat. Now, the other thing too is the standard American diet. If you look at your best sources of zinc, they're actually going to be coming from organ meat like liver, but then another great source of zinc is going to be oysters. So if someone is vegan, they do not eat any animal products, I'm going to get all of it coming from my sources of plants. But there's something interesting I'm going to show you in a second why it will cause poor absorption. And obviously, if you consume the standard American diet, do we really need to say anything more than that? Because the standard American diet is absolutely horrible. The recommendations of our, the United States Department of Agriculture, in my opinion, are comical on what they are telling you need to do. If you followed the USDA nutrition recommendations that a lot of nutritionists are follow, then you are actually setting yourself up for vitamin and mineral deficiency. You're setting yourself up for type 2 diabetes. The other thing is you might be getting enough, but you might be having a problem absorbing it, okay? Where it gets absorbed is within the small intestine, and here's what's interesting. High zinc intake will actually compete with another essential micromineral that you need in your body. It's known as copper. So you need about 10 to 15 milligrams of copper or of zinc, but you also need about 3 milligrams of copper per day. If you have low copper, you can actually become anemic. So if you are getting 6 to 7 times the amount of zinc that you're taking specifically within an isolated zinc supplement, you then can compete with copper and cause poor copper absorption, leading to copper deficiency. And here's another one, gastric surgery. Guys, don't get me started on gastric bypass surgery. Now, either people who have undergone a gastric bypass, but also people who have had, feet of their intestines taken out because it has been so inflamed. This can cause problems with lack of absorption. Guys, anytime that they're shrinking your stomach and they're shrinking the surface area of the stomach, you are going to have a really, really bad day when it comes to your ability to be able to break down your food. And every single person that I have seen that has had a gastric surgery, yes, it resulted in weight loss, but then there are other problems that take place because you are messing with the body's physiology. Guys, one of the biggest reasons why gastric bypass surgery, why they do it, and in fact, I read an article about this, and I'm trying to quote this off the top of my head, but the reason why it worked has nothing to do with them stapling the stomach. It's that they made the stomach so small that they went on an extreme caloric restriction of 500 calories a day for a period of time in which their body went into starvation mode. So I'm like, man, you could save yourself $30,000 or $40,000 and just lock yourself into a room and just have someone slide under the door 500 calories a day, and you'd save yourself a whole heck of a lot of money. Because even with gastric bypass surgery, if you don't change this, it's only a matter of time before you go back to your destructive behaviors that led to the reason why you wanted it in the first place, which is why the success rate isn't very good. And you'll see people over time, the stomach will then start to adapt, and people are right back to where they were in the first place. But this time, they're even sicker. So here's what's interesting. Dietary factors influencing zinc absorption. Dr. Nate, where did you get this? Well, I got it from PubMed, from the Journal of Nutrition of 2000 in the month of May. So here's what's interesting, because this actually goes against, because I know I will always have people who will defend being a vegan, through and through, and it's an emotional defense rather than a logical one. Now, don't get me wrong. There are some people that we do food allergy testing with in which I say, hey, for the time being, you're going to need to be mostly vegan. There's a reason for that. And then there are some people who say, hey, you know what? The best diet that you're going to need to buy is a almost strictly carnivore diet. There's always a reason behind any kind of recommendation that we actually make. So in the Journal of Nutrition 2000, dietary factors influencing zinc absorption, and here's what they say. Inhibitors of zinc absorption are most likely the most common causative factors in regards to having a zinc deficiency. It's not that you don't get enough dietary zinc, it's that you're not absorbing it. Now watch. Here's what they say. Phytate, which is present in staple foods like cereals, corn, and rice, has a strong negative effect on zinc absorption, from composite meals, okay? So they actually just said it right there. If you want to inhibit absorption of zinc, go ahead and eat a lot of grains, a lot of corn, and a lot of rice, which is plant-based carbohydrates. Well, Dr. Nate, there's zinc in it. Because they're attached to phytates, and that actually doesn't allow for the absorption of zinc within your intestines. Now, I want you to think of this. Who are the people who got absolutely crushed by COVID? They were the hypertensives and the type 2 diabetics. And what are a lot of them eating? Cereals, corn, and rice. They're eating simple carbohydrates, and I'm sure that they're getting plenty of zinc, but their absorption of the zinc was probably absolutely abysmal. So here we have a protocol. The doctor says start taking more zinc, and yet they already had enough zinc, but the absorption of it was absolutely terrible. Here's another interesting fact. Cadmium, which is increasing in the environment, also inhibits zinc absorption. The amount of protein in a meal has a positive effect on zinc absorption, but individual proteins may act differently. For example, casein has a modest inhibitory effect of zinc absorption. So what is casein? One of the proteins in dairy. So you got casein and you got whey. Okay, so if you are drinking a lot of milk because it does a body good and because you need the calcium, which you can easily get from other sources of food, then it has actually an inhibitory effect on the absorption of zinc. And this right here is absolutely on the rise, is cadmium. And this is a lot of times if you see a recall of painted toys that come from China, they're very, very high in cadmium, okay? Now going back to this individual I saw today whose immune system was absolutely being crushed, who ate all organic, who, I mean, everything that she ate was organic, but there was something going on that was causing the immune system to be suppressed. You have to start looking deeper. And I said, listen, here's what might be happening, and here's probably where we need to test. Probably need to do a viral panel and look for things like Epstein-Barr cytomegalovirus, some other viral infections that might be going on. You may have mold toxicity that's going on. We need to look into that. Or there may be some kind of heavy metal toxicity that you've been exposed to that is absolutely crushing the bone marrow. In fact, if you look at lead absolutely destroys your body's bone marrow, which is where all of your white blood cells and your immune cells and red blood cells are being produced. So they actually talk about absorption, okay? Now here's where it gets really interesting, guys. And if you're enjoying this, please, please, please share this, okay? Now watch, elemental zinc and copper compete for absorption in where? The small intestines, okay? So zinc and copper compete for absorption in the small intestine, which means if you are dumping a bunch of elemental zinc in your body because the protocol actually says so, and you're doing that long term, then you can become, in the process, copper deficient. Now watch. Here's what it says, National Institute of Health, National Library of Medicine, PubMed, and they say this, health effects of copper deficiencies. There can be effects on the bone marrow with a copper deficiency. A sensitive cell line with regard to copper deficiency is the red blood cells, perhaps because copper is required for the synthesis of heme. Now, thus, anemia is often thought to be an early bone marrow effect. So one of the first things that you can actually see with a copper deficiency is anemia. So you look and you have seen your numbers and say, wow, I'm anemic. There's more than just one thing going on possibly than just being iron deficient. You might be iron deficient, you might be B12 deficient, you might be copper deficient, you may not have any deficiencies at all. Instead, you might be bleeding too much every month with your menstrual cycle because now you have hormone issues. Or the other thing that might be going on is it may be just as simple as you're way too stressed out, you're not actually secreting enough stomach acid, which is needed in order for you to be able to absorb those things. So you see, guys, there's so many different reasons than just taking this for that. The more long-standing the copper deficiency, the more likely the red cell indices will become hypochromic microcytic anemia. Because copper is also required for cellular proliferation, the effect on the bone marrow can also produce leukopenia or low white blood cells, particularly neutropenia, the neutrophils, and also thrombocytopenia, okay? So all of these different things can take place because those cells are actually made within the bone marrow. So one of the first things I did for this person is I said, the first thing let's start doing is let's start getting your zinc and copper back up until we have the ability to be able to test these things a little bit further, okay? Now, on the subject of copper, please pay attention to this too, because you can also get too much copper as well. And one of the places where you can get too much copper has to do with a common birth control method, the copper IUD, also known as Paragard, okay? Now, I've seen this on x-ray and they're saying, yeah, I'm taking a copper IUD. And well, why do you have a copper IUD? Well, I didn't want to take any kind of hormonal birth control, so I want to have a birth control device inserted in order to basically block the egg and the sperm from coming together, okay? Now, here's what's really interesting. If you look on this comes from Mayo Clinic. Now watch, okay? So Paragard is an intrauterine device that can provide long-term birth control known as contraception. Okay, well, all right, I guess that makes sense. But let's figure out why it's providing birth control and contraception, okay? It's sometimes referred to as a non-hormonal IUD. And you don't have to look very far to know that IUD, any kind of birth control that's involving hormones will devastate. It will devastate the body long term. Taking increased progesterone will lower the immune response. It will cause GI issues, and also taking it with any kind of estrogens, not estrogen, but estrogens, can also place an additional burden on the liver and can also mess up thyroid production as well via sex hormone binding globulin. Now, here's what they say. The Paragard device is a T-shaped plastic frame that's inserted into the uterus. Copper wire coiled around the device, now listen to this, produces an inflammatory reaction that is toxic to sperm and eggs, preventing pregnancy. Did you just catch that right there? It produces an inflammatory reaction. That doesn't seem very good to me, to produce an inflammatory reaction within your uterus. Because if you are producing a low-grade inflammatory reaction, remember, inflammation is the spark that creates disease inside of the body. So what is happening? You are attracting immune cells to that area, probably natural killer cells. Guys, look at one of the reasons for infertility, and you will actually, if you type in natural killer cells and infertility, you will actually see that that is one of the reasons why that infertility can be due to an immune response, okay? Now, they say Paragard isn't for everyone, but it's safe, but then again, it's not for everyone. Here's how to know if you should not use it. If you have any uterine abnormalities, such as large fibroids, interesting. If you have a pelvic infection, such as pelvic inflammatory disease. So you mean if your pelvis is already inflamed, they don't want to inflame it anymore. If you have uterine or cervical cancer, so you mean to tell me that if you have uterine cancer or cervical cancer, by inserting this device and producing another inflammatory response can make your cancer even worse. Have unexplained vaginal bleeding, are allergic to any component of Paragard, or have a disorder that causes too much copper to accumulate in your liver, brain, and other vital organs, known as Wilson's disease. Now, here's what's interesting about Wilson's disease. People are like, I have Wilson's disease. I seem to deposit copper within my tissues. But what they say is that, well, that copper, it doesn't leach into your tissues, but yet if you have Wilson's disease, they're saying it's going to leach into your tissues and you're going to deposit that and won't be able to excrete it from the body. So they're just admitting by looking at that copper can become extremely toxic. So yes, you can have problems with deficiency of copper, but you could also have problems with excess of copper. It's the same with anything. You can die if you don't have enough water. You can also die if you have too much water. You can get sick because of not having sufficient hormones. You can also get sick if you have too much hormones because you cannot metabolize them properly, okay? So let's talk about this whole idea behind zinc and copper, because you might be asking this question, Dr. Nate, where on earth should I be getting then my zinc from? Because remember, zinc is not bad, okay? Copper is not bad, but getting them in high amounts and taking zinc isolates can actually inhibit and cause copper deficiency, which is going to cause other issues. You may be taking enough zinc, you can't absorb it because of small intestinal issues that are going on. So where should you be getting your zinc from? Here's the safest place, is from getting it from food. Get it from food because it is not isolated zinc. In fact, the zinc that you can get from oysters and the zinc that you can get from liver also will contain things like copper already in it, as well as a bunch of other micro minerals that you're going to need as well. So you can never go wrong from getting it from food, which is what we always will try to do, is we'll tell people, here's how you can get it from food. And people say, well, that sounds really gross. That sounds really disgusting. I don't want to eat liver. I don't want to eat oysters. And you know what I tell them? I agree, 100%. Eating oysters sounds very disgusting, and eating liver sounds just as disgusting as well. So maybe instead you can take it from in a pill, desiccated, dried form. So this is why for a lot of people, yes, we do recommend zinc, because zinc plays a role in so many different things. And I know that probably a lot of people are zinc deficient, mainly because of that they're getting it and it's not getting absorbed because of phytic acid, because people consume way too many processed carbohydrates and grains and certain plants that are high in phytic acid, okay? So you can get it from animal sources, and you can also get it in desiccated if you don't want to eat oysters, you don't want to eat liver. Now, I rarely do this, but I will do this now because I think that it's important, and I think that this is pretty universal in people. So do I think you should be taking zinc? Yes, but you should be taking zinc with copper, and you can also get zinc coming from a liver glandular that will also contain copper as well, okay? So you guys, if you want to, because people ask me all the time and I say get tested, but one of the reasons why we say, hey, I think a lot of people can benefit from eating liver or taking a liver glandular is because it really is nature's multivitamin, okay? Because there's going to be adequate sources of vitamin A, adequate sources of vitamin E, adequate sources of really your fat-soluble vitamins, and then a lot of your minerals and microminerals, including CoQ10 as well. So you can order this, guys, from store.thewellnessway.com, but you're going to need a code to do that gives you authorization to be able to purchase it. Guys, my code is 5058. Make sure you take a screenshot of it, and you can go and you can start on liver glandular, okay? You can go on and now our liver is actually coming from New Zealand. How are you guys doing in New Zealand? Grass-fed cattle, okay? So it's going to be one of the purest sources of liver. So you can get zinc, you can get the liver glandular. All you got to do is go to the store.thewellnessway.com, create an account, check that out, and then you put in code 5058. We'll authorize you to be able to get it. How is that, guys? We're always giving you some awesome things. So here's what I want to say, guys, in closing, okay? So hopefully you guys see a different perspective. Here's what I want you guys to encourage you guys to do. Please, please do this instead of doing the protocols and finding the next bright shiny object and liver detoxes and colon cleanses and fasting and things like that without ever having any kind of blood work to even know if you should be doing it or not. You guys need to stop looking for protocols and programs, guys. Please stop looking for the protocol. Please stop looking for the program. And please work with a Wellness Way doctor who can tell you if you need to do it or not. Because again, we are masters of labs. We're masters of looking at blood work. We're masters of physiology. And guys, some people have been working on their gut for 3 years. And I'm like, do you realize how quickly the gut and the microbiome can change? It literally can change in 3 months. And yet some people are still working on it because they've got to figure out their protocol, and they've been working on it for 3 years with little to no results because of the understanding it takes on how physiology actually works. So this person right here that you see, low in CD3 cells, okay, which is our CD4, CD8. You can see low in CD8 cells. You can say low in CD19 cells or B lymphocytes. You can see low in all those things. All was actually doing okay when it comes to their natural killer cells, and doing okay when it comes to their CD4 cells. And by the way, when you look at their CD4 cells, their vitamin D levels were perfect. Okay, so you can look at very low in overall lymphocytes, and even when you look at this tumor markers, you can actually see those tumor markers. Even this person in their early 40s, you can see tumor markers start to increase. And this is because cancer doesn't jump inside of your body. You don't go from one day not having cancer to the next day having cancer. Is these things grow over time, and it's only then in which a doctor's fire department labs can pick it up, in which case you're catching it way later than when it needs to be. Remember, with cancer is you have to have a change in physiology first before you see a detectable tumor. Wouldn't it make more sense to notice the changes in physiology before waiting until it's obvious on some kind of x-ray or some kind of colonoscopy or some kind of biopsy that the cancer is actually there? So we're catching this in time before it turns into something obviously much greater. Stop looking for the protocols and the programs and start testing properly. Hopefully, guys, that makes sense. And again, guys, if you are from the Chicagoland area, I will say within an hour and a half or so, please go to the top of this page and please register for coming up in about 4.5 weeks, July 23rd, our Man Up event, in which we're going to show you how to increase your testosterone without the gimmicks. On that day, we're going to be going over what the 4-week, I'm going to say program, but the reason why is because I'm going to show men some universal things that men can do that are universal to men. Women are a lot different, but there are certain things that every single man will benefit from lowering their sugar, will benefit from fasting, will benefit from doing high intensity, short duration exercise, and will benefit from achieving adequate sleep, and will also benefit from changing their mind from one that is soft and one that desires comfort and safety to one that is actually now going after it, desiring risk and desiring reward. And so we'll go over what that 4 weeks is actually going to entail, as well as self-defense and how to handle a firearm, which is going to be very important in the next couple of months, in my opinion. And so make sure that they get registered for that. Registration is now open. Go to the top of the page. You'll see the Eventbrite link. And then register for that. But guys, if you are not from the area, we do not have a link yet as far as to register for that. We'll put probably a separate link for those of you who are out of state, for those of you who are maybe out of the country. We just need to know if the interest is there. Please don't answer for your husband. It's got to come from them. And so if we fill this up first in person, we'll open it up to online, in which we'll actually develop some things as far as exercise that they can do at their home without any kind of heavy equipment or any kind of equipment purchases or anything like that. So again, please give me feedback if you are from a different country or from out of state, if your husband or your significant other would appreciate doing that and would be interested in doing that. And that way we can start to handle some of the extra things that we need to do with media and things like that to get those things obviously in order. Okay. So guys, I hope you have an awesome rest of your night. I hope you guys are blessed by what I had to say, and I appreciate from the bottom of my heart you wanting to listen. I appreciate your shares. I appreciate your like. I appreciate your feedback. You guys make it worthwhile to come every Monday night to share my heart and to share clinical experience with you guys. I appreciate it again from the bottom of my heart. So I hope you guys have an awesome night. Be well, be blessed, and we'll see you guys very soon.